Welcome doctors, today we're diving into one of the most important skills in hospital billing, ICD-10 coding. Accurate coding isn't just about numbers and letters, it's about ensuring proper reimbursement, and ultimately supporting high-quality patient care. When coding is done right, it safeguards the hospital's financial health and ensures patients' medical records reflect the true story of their care. When coding is done wrong, it leads to claim denials, delayed payments, and even legal or financial penalties. That's why your role as physicians, and the training of billing staff who work with your documentation, is absolutely vital. Before training begins, it's important to understand where staff currently stand. A skills assessment. Whether through quizzes, one-on-one interviews, or a review of recent coding work helps identify knowledge gaps. Once those gaps are clear, training can be tailored to ensure no one is left behind. At the foundation of ICD-10 training is understanding the system itself. ICD-10 has two main parts: ICD-10-CM, which covers diagnoses, and ICD-10-PCs, which covers procedures. Codes are alphanumeric, up to 7 characters long, and each part of the code tells a different piece of the clinical story, from the category of the condition down to its specifics. Staff must also understand coding conventions like excludes 1, excludes 2, includes, and code also. Without mastering these basics, it's nearly impossible to code accurately. Next comes diagnosis coding. This is where specificity truly matters. General codes won't cut it, your billing staff need to pick the most specific code possible. For instance, instead of coding simply hypertension, they should know to select whether it's primary, secondary, controlled, or uncontrolled. And this depends entirely on the quality of your medical documentation. Clear, precise physician notes allow billing staff to translate your clinical work into accurate ICD-10 codes. When it comes to procedure coding, particularly ICD-10 PCs in inpatient care, detail is equally important. Every procedure code has 7 characters, each describing an aspect of the procedure, from body system to approach. Understanding the 31 different root operations, like excision, resection, or replacement, helps staff assign the right code based on the operative note. But even the best training means little if staff fall into common traps. Upcoding, choosing a more complex code than the documentation supports, sort down coding hurt compliance and reimbursement. Errors with modifiers or using outdated codes are also frequent mistakes. That's why annual updates to ICD-10 must always be part of staff education. The right tools can make this process much smoother. Updated ICD-10 codebooks, online coding platforms, and guidelines from professional organizations like AHIMA or AAPC provide the resources billing staff need to stay accurate and current. Of course, learning isn't complete without practice. Real-world case studies, mock patient charts, and group discussions bring coding concepts to life. The more staff practice coding based on physician documentation, the more confident and precise they become. Training doesn't stop once the initial sessions are over. Progress should be monitored through regular audits of coded claims, ongoing education, and feedback sessions. Monthly or quarterly reviews help catch recurring errors early. So, what's the takeaway here? Training hospital billing staff in ICD-10 coding isn't a one-time event, it's a continuous process. It starts with understanding, builds through practice, and continues with ongoing education. With the right training and your commitment as physicians to provide clear documentation, hospitals can achieve accurate coding, improved reimbursement, and stronger compliance. And that, in turn, supports better care for the patients we all serve. Thank you for joining me, doctors.